Hi everyone, and welcome to the Center for Innovation in Campus Mental Health webinar series. We'll just take a few minutes to wait for some other attendees to log in. All right, we'll get started. So thanks so much for joining us today, and we'll talk about how to address mental health and well-being by creating a balanced and supportive physical environment. Some housekeeping before we get started. So everyone is on listen-only mode, and everyone is mute. We'll be taking questions about around 1:45. So if you have any questions, feel free to type them in the question box, and we'll start answering them about in 45 minutes. The webinar is being recorded and will be available on our website. You'll get an email with all this information tomorrow. And the presentation slides are available for download right now. So you have in the handout sections the two presentations, and again, we'll send out the links by tomorrow. Finally, we do have a short survey at the end of this webinar, so please feel free to answer it. It just takes a couple of minutes, and your answer is really helpful to us. So I will introduce myself. My name is Pauline Spies, and I'm the Research and Knowledge Exchange Coordinator at the Center. And I have the pleasure to be joined today by Lovelet Ford, which is right here, from George Brown College, as well as Amanda Austin, from OCAD University. Thanks so much for joining us today. So without further ado, we will get started with a Lovelet presentation. There we go.
Hi everyone. My name is Lovelet Ford. I'm a counselor at George Brown College. I've been at George Brown College for the last 11 years, and we help students with any personal, academic, or career issues. Most recently, I was on sabbatical from 2017 to 2018, and during sabbatical, I was developing a wellness program for staff, faculty, and students. And the focus of the wellness program was really to do different initiatives that can help them with their wellness and their well-being. And part of it was developing different programming for staff, faculty, and students, and as well to looking at the space and how space is designed. Most importantly, I thought it was really important when I was putting together the wellness program was the holistic approach. So not only looking at how it can impact students, but staff and faculty as well too, which led me to get connected with Center for Innovation in Campus Mental Health to talk about wellness, well-being, and design, and how it can impact mental health. So let's get started.
Yeah. Or maybe the lower one. Sorry, maybe this one. Oh, that's strange.
Sorry, one sec. We're just having a little bit of technical.
Sorry about that. Oh, here we go.
Okay, so we're going to take a look at the outline, and we're going to look at two theories of well-being. And while I look at the different theories, I'll also look at how to incorporate wellness and well-being into the space as well too. So we'll look at well design, and then we're going to look at gaps as well too. And then we're going to look at just kind of looking at some statistics and looking at why built design space is important to mental health and well-being in post-secondary environments. So I'll start with the poll question, just kind of getting a gauge on how different people see wellness and well-being and designing space. The first question I'm going to ask, do you think it's important to consider well-being and wellness when designing a space? So if you just want to tally at the bottom, And you have three options, so yes, no, or if you're unsure. Okay, so it looks like there's a strong response for yes, which is great, and a couple are unsure, and that's totally okay as well too. So we've got 97% for yes and 3% for unsure. And then I'm just going to ask the next follow-up question is, are you familiar with wellness and well-being design? Is the other one. So we just want to enter in your response. So yes, somewhat, and no is the other response. Okay, so it looks like we're kind of split in between somewhat, that there's about 46% of people have somewhat knowledge of it, 41% no, and then 13 yes. So the first part of the webinar we'll be looking at really is two theories on design and well-being, and how we can incorporate these theories into our space. So the first one we'll start with is, what is well design? And just a kind of a brief overview of well design. It's evidence-based health and mental wellness intervention. It's the leading, like the fastest growing human-centered approach to health and well-being in the built environment. As well too, this standard can be used for best practices in both design and construction. So it could be in design of the space that you are updating, or it could be from the very beginning, the construction aspect as well too. There's 7 different purposes for the well design. So they have air, nutrition, mind, comfort, fitness, and sleep and performance. And all of these things they include when they are making a space well certified. So what we'll be looking at are the different 7 concepts. Another way to look at it as well too is the well building standard is the way people think about building, how it's designed, the operations and behaviors within the places where we work, live, learn, and play, and can be optimized to advance human health and well-being. So it's really looking at how the space that we're in is impacting our human health and our well-being as well too. So we'll dive in, we'll look at the 7 concepts. So the first one is air, and then for the well design, when they're looking at air, they're really looking at finding the importance of clean air. So the space that you're in needs to have clean air, and that's regularly ensuring the air quality is good. The other thing too is just to note that good air quality is going to really support the health and wellness of all individuals within that space. And so there's different ways that you can incorporate that to ensure there's clean air within your space. One of them is going to have like an air purifier within your space. The other one too is like different plants, and we'll talk about green spaces a little bit later, but that's can be another place as well too where you can incorporate plants, which can help to purify the space as well too. So on the slide here we just have the English ivy and as well too the snake plant, which can help to purify the air. Nourishment is another aspect the well design looks at. So within your space that you're having healthy nutritional food. So it's that individuals who are within the space, so it would be at colleges, universities, different work places, that these individuals who are in the space have access to healthy food within the building, and as well too with those different food options that they are getting informed about the different dietary choices that they have. So an example that we have this at George Brown College is that we have the Good Food Market. So we just on the slide kind of towards the bottom, you see on the top is one of our students at the Good Food Market, and we have this each week that students, staff, and faculty can come in and purchase fruits and veggies at a reduced fee and have access to fresh fruits and veggies. The other aspect that the well-designed, so the third one they're looking at is light, and it's really to look at how much is the light that you have in your space, if it's natural light or if it's artificial light, how that's really impacting you overall. And with well-designed, they are definitely evidence-based and research-based. So what they have found is that you need to have proper lighting in your workplace, and as well too that that's going to be impacting like your productivity, and as well it's going to be impacting your quality of sleep. So when spaces are designed and that they have good light, that's going to impact you in a positive way. Some studies have shown as well too for students in post-secondary environments that really important to keep in mind is that the students benefit from good lighting in a classroom. So in 3 different ways. So one, they have better performance in the classroom. They also demonstrate better level of social behavior, and they also show higher levels of well-being. So there's all these different positive aspects when there's good lighting within a space that students could benefit from. And other things to look at too with lighting, it might be like a lot of spaces that we're in, they don't have natural light, so it might be incorporating like vitamin D lamps within different classroom settings or in wellness centers within the college or university setting that helps students to access that vitamin D when they might not get that natural light. The other aspect we're looking at is fitness for the well-designed. So they really look at how you can integrate physical activity into your everyday life and allowing for opportunities of active lifestyle that would discourage like the sitting disease behavior, where there's a lot of studies that show for individuals who are sitting for long periods of time how that really impacts their long-term health. And it also looks at incorporating different activity incentives and having some structured fitness programs. So different examples of this could be at a treadmill at a library. So at George Brown College at our waterfront campus, if you haven't been, I definitely encourage you to go there. It's a beautiful campus. The library overlooks the lake. And we also have treadmills that are available there for students that they can study. As an example, this is a picture, and they can be walking a treadmill. So they're being active and they're also integrating that in their everyday life. The other thing is also having a structured fitness program. So just an example here is different fitness activities that we have at George Brown College for both staff, faculty, and students, and as well like to prevent the sitting disease, having like stand-up workstations as well too. And another part of the well-design is water, which is essential for life for all of us, and it's that really ensuring the space that we are designing or in all our spaces for our wellness and well-being, that individuals have access to water so that that's accessible for all individuals. This water would need to be filtered and treated and available. And these are just some examples that to incorporate that into your space. One could be if you're doing a DIY station. At the bottom there's a picture that you can just have like your just fill that water jug and to add some lemons or limes. The other one too is it's great to have standing water stations, and this is like the filter for the water bottle that individuals can just bring the water bottle and have that filtered water there. But water would be another aspect of the well-designed to incorporate into space. Comfort is another one, and comfort is really looking at the key aspects of how comfortable you feel in the space that you're in. So the temperature, that makes sure the temperature is comfortable for all individuals. It's looking at the sound level, so what sort of sounds you're hearing around the space that you're in, and as well too the ergonomics aspect. So some pictures below are just showing the one of like the lounge and the work area, just showing how that's like a flexible kind of workstation area. And then on the left side, just showing the ergonomics, like really important for individuals when they're at different workspaces, that they're having workspaces that are going to be beneficial to their body and not compromising their body in any way. Mind and well design is the other aspect, and it's really looking at supporting mental health, emotional health, knowledge, and awareness. And different ways that this can be done is having flexible and adaptable spaces. So in the picture, it's just showing that there's a lounge kind of area here that individuals can sit down, and there's like a workstation area over here There's a quad area over towards the right, and there's like a private workstation. So this workspace is definitely very flexible, and well-designed is looking at that, like how flexible can you make it based on different needs, because individuals, we all have different needs. So this space is very adaptable and helps to make the workspace adaptable to different people and their specific needs. So it could be just incorporating different simple things with rearranging some workspaces to help for them to be more flexible. The other thing that they also look at is that policy as well too. So it's just looking at what sort of policy, organizational policies are put in place. It could be mental health and wellness, but are these policies being recognized as at colleges, universities, or in different workplace environments that are going to make certain things mandatory to have the space be designed in a wellness and well-being aspect. So those are 7 different concepts, and what we'll do now is going to just to further elaborate on those 7 concepts, let's take a look at the WELL video.
I think it's now time for wellness to come to the fore, because as an industry we are well versed on sustainability and its broader implications. This is the next level.
The spaces that we live and work in every day have a significant impact on us as human beings.
We don't consider the human health and wellness of people who occupy the space we create. We're not getting it right.
A well building is one that is designed and constructed and maintained to improve the health, happiness, wellness and productivity of its users.
We are considering their well-being as a core value to our organization. Everybody wants good quality air. Everybody wants high quality water. The interesting things about the WELL standard is that for the first time, we're really quantifying things like the role of nourishment and mind.
What this is really doing is dealing with chronic issues that are affecting our workplace. Designers can actually create spaces that incorporate solutions that affect the human body.
就是在所有的建筑当中，大家都知道有很多成熟的标准，但是这是第一步，是国际性的、全球可以适用的一步，关于建筑和人的关系的，特别是人的健康的关系的这么一个标准。
What I love about the WELL standard is the fact that it is based in scientific research. We're not reinventing the wheel. We're looking at how do we take that data that already exists out in the public to create our buildings.
It's a third-party, evidence-based, science-backed rating system that tells you how your space is performing.
To have someone come on site and physically test our space was pretty incredible, so that we could get live feedback from all of the systems that we had designed.
Employee satisfaction is absolutely crucial, and it's a clear predictor of business performance. We get fantastic feedback from our employees working in this space.
They're saying things like, I'm sleeping better. They start talking about how they love coming into the office every day.
Human cost is one of the highest costs, up to 90% of operating a business. So retaining and attracting the best people is really important.
And I think when employees see that this is something that's a priority to the company, I think they recognize it's a company that they want to work for.
The WELL building standard is an easy choice. $1.10 per square foot for our project, less than $1 a day for an employee. The return on the investment is priceless. It really can't be measured.
If you want to keep your people productive and passionate, make sure the workspace is a healthy, vibrant environment.
In the same way with the green building movement, once we knew how to make buildings better for the planet, we had to do it. It was a moral imperative. Now we know how to make buildings better for people. We have to do it.
Okay, great. So that's just an example of more detail of the WELL design. And so these different concepts can be used in any space. It could be for work office space, it can be for college, university, it could be for individual workspace. And I should also preface that these are pulling from different concepts from the WELL design. They also have a process too where individuals become WELL certified, but I thought this is a great introduction, just talking about different things that we can keep in mind when we're designing space to really focus on our wellness and our well-being. So some stats just to look at why it's important to keep into mind of the space and how it affects our wellness and our health in mind. Just some stats. So globally, about 76% of employees report a struggle with well-being. So it's impacting at least quite a chunk of us. As well, too, 75% of first-time mental health diagnoses occur between 16 and 25. So really that it's really impacting a lot of our students in college and university settings, and to really think about when we're making spaces for them, like how can we make these spaces best for their overall well-being. As well, studies show that employees who are in a well-being space outperform an average by 10%, and globally 1 in 4 people experience a mental health problem within their lifetime. At the bottom, I just included some stats on urbanization, because it really affects quite a lot of people in urban areas more significantly too. And we'll talk about gaps for the next couple of videos, and they specifically focus on designing spaces in urban centers. And just some stats for that: in 2014, the urban population made about 54% of the global population, comparison to 1960 was 34%. So more than half of us are living in urban populations. And for city dwellers, they have an almost 40% higher risk of depression, over 20% more anxiety, and double the risk of schizophrenia, in addition to more loneliness, isolation, and stress. So that's just showing how in urban cities, mental health is impacting individuals differently. And that's what we'll look at the next couple slides of how we can really look at their wellness and well-being with the spaces design. So the other theory that's used is from the Center for Urban Design and Mental Health in Mind, and they have an acronym called GAPS, and it's for green spaces, active places, pro-social places, safe places. This theory framework is also evidence-based, and it can be used to how cities are designed and as well for different spaces, and it was founded in the UK in 2015. So the green spaces, what they're looking at is that individuals have access to natural settings. So that could be in parks, it could be waterfronts, it could be gardens, and this is going to help to improve and maintain the mental health and well-being for the individual. As well too, that could be community gardens. Some examples of how that's been incorporated into different college and university settings is at Ryerson and also at George Brown College. We have mood routes where students go out, they go out for a nature walk, usually about 1 hour, and they have a chance to connect with others, and as well too to be in nature as well too, to really help with their overall well-being. The other part is active places, and it's really providing spaces that integrate physical activity into your daily life. So on the right-hand corner is a picture just like having bike lanes that are accessible and that people can use. And then as well too, that there's a community gathering at the park that people are integrating their daily life with physical activity, and providing a space where individuals in the community can interact and connect with one another. Pro-social places is the other one, and it's designed to facilitate positive, safe, and natural interactions among individuals and promote a sense of community, participation, integration, and belonging. So it's really looking at, are there spaces available for individuals to interact, and to interact not only that they're going out of their way, but it's also a natural interaction that's occurring for that. And that through that process, it's helping to build community with people, and as well that they're finding a sense of belonging within that community too. So example of that would just be like a lounge on a floor residence that that really is a space where individuals on that floor would come together, get to know each other, may share meals together, but it's a natural interaction that they're occurring. Lastly, for the gaps is safe places, and it's really looking that there is a sense of safety and security, which is really important for the overall well-being for an individual, that they're feeling safe and they're feeling comfortable and they can move around their spaces and neighborhood and community and they're feeling safe. So some example of that are having emergency buttons on campuses, as well as like having well-lit areas available throughout campuses, like having the safe walk as well too, are another example of that. But these are all things to keep in mind when we're thinking about space for students and designing space, that these are really integral parts that are really important for their wellness and well-being overall. So lastly, there's just a couple of resources I have here. How well is your workspace helping your wellness is one article I wrote for the Center for Innovation Campus Mental Health. As well, too, there's 2 different links that are for the well and the gaps. And then my contact information there is listed below if you have any questions, but we'll have questions at the end too.
All right. Oops. Thank you so much, Lovelet. So I will now pass it on to Amanda. Just give me a couple minutes for the switch. All right, Amanda. Make sure you unmute yourself. Let's see.
Okay.
Perfect. We can hear you. Go ahead. Yes.
Okay. So a little bit about myself. I started with a Bachelor of Interior Design. I continued on to do a Master's of Design in Inclusive Design, and I've dabbled in building science a little bit. I'm also a LEED accredited designer with a passion for sustainability, accessibility, and advocacy. I strongly believe that as designers and facilitators and leaders, that it's our responsibility to design and provide places and spaces for everyone and advocate for the minority. Because if not us, then who? I conducted this study because I work as a corporate designer and I wanted to make sure my master's was applicable to my career. So in other words, how can I make spaces more inclusive? Okay. Will it go to the next slide? Oh, there we go. Okay. So this research study had 3 main goals: to investigate the mental health challenges experienced by students aged 18 to 26, evaluate the current support available and used by those students, and propose an alternative method of addressing mental health challenges in a more holistic, welcoming, and supportive manner. The study was inspired by the increase in mental health awareness and recognition that post-secondary schools are struggling to meet the needs of students. So from a literature review grew a hypothesis that multisensory environments could help students experiencing stress, anxiety, and depression by stimulating their primary senses without the need for intellectual functioning. So multisensory environments are failure-free and help people to feel relaxed and regain control of their surroundings. So the way I set up my study was basically in 2 parts. So the first part had a positivist perspective to determine a single truth or reality. The methodology I used in the first part were through surveys and experimental research. It was quantitative data and gathered through an online survey. The second part was an interpretivist perspective, where reality is created by individuals within their groups. I used an ethnographic approach, grounded theory, and action research, which provided me with qualitative data, which could be quantified further down the road. And the methods I used were the long answer questions in my survey, expert interviews, and site visits. So I began by asking the question, how do spaces affect our mood and transform our behavior? So spaces are supposed to and subconsciously make people feel something. We need to address how students are feeling at school and respond accordingly. Traditionally, multisensory rooms have the ability to engage users, encourage communication, and even delight the user. So studies suggest a multisensory interaction may allow students to regain control of their feelings and help cope with the struggle to deal with the impact of life challenges. Multisensory elements can be used to create familiar experiences through intentional space planning, recognizable smells, interactive activities, acoustic manipulation, to name a few examples, which help to create and facilitate a safe space for people. So mental illness affects millions of people daily, and according to the Canadian Mental Health Association, suicide accounts for 24% of all deaths among 15 to 24-year-olds second to accidents. So as mentioned, the demographic most likely to experience mental illness, 15 to 24-year-olds, likely begin to develop serious challenges during high school. Now, for the sake of my study and to prevent risk, I used the age gap starting at 18 years old. But I did want to touch on the fact that people begin to experience mental health challenges earlier than adulthood. 34% of Ontario high school students indicate a moderate to serious level of psychological distress, while 14% indicate a serious level of psychological distress. The Mental Health Commission of Canada further explains that the highest rate of mental health problems and illnesses is among young adults aged 20 to 29, a time when young people are generally beginning post-secondary education and careers. So these statistics are quite staggering numbers that typically increase once young adults transition to post-secondary education. Suddenly there's so many more aspects of life to worry about. Some of these stressors, could include financial independence, meeting family expectations, living with strangers, maintaining a healthy diet and lifestyle, transportation. These are all things that may not have affected individuals while residing with their parents or guardians. And on top of these items is the stress that post-secondary education creates, which are meeting deadlines, getting to class, working with others, and navigating new places, to name a few items. So some of the factors and considerations would be thinking about the stigma that surrounds mental health, the amount of awareness that we create, the amount of funding that's allotted to mental health resources, and we also needed to think about the current responses to mental health in post-secondary environments, which, to name a few, are counseling services, helplines, online platforms, programs and social groups, and environmental support. So the next concept that I'd like to introduce you to, which some of you probably already know, are Snowzone rooms. And Snowzone means to seek out, explore, and relax. And the purpose is meant to be a non-directive approach that allows free choice of interaction with stimuli needed to be active. And the items there listed are benefits of Snowzone rooms. Multisensory environments provide individuals with the opportunity for stimulation and relaxation through interactive strategies. So in the conventional healthcare space, multisensory rooms are being used to promote calming and relaxing sensations in children, individuals with dementia, people with learning disabilities, autistic individuals, trauma patients, and mental health patients. So as I mentioned, these are all more clinical settings. These environments can appeal to the sense of touch, sound, sight, and smell through interaction and response with equipment, tools, or items. So currently, Snowzone rooms serve a specific purpose in that they are meant to be a non-directive approach that allows free choice of interaction with stimuli needed to be active. And the next slide has a couple of images of examples of Snowzone rooms. So they could include furniture that allows for movement, such as rocking, vibrating, rolling, bubble tubes, fiber optic lighting, wall washers, tactile stimuli, music, smell, or sound. And I want to touch on a study that I came across, which actually helped to inspire my research. It was conducted in the UK and the US, and it analyzed the effects of multisensory rooms on mental health nurses. So the nurses were often experiencing occupational stress and burnout, After using multisensory rooms, the nurses were unanimously satisfied with their experience, reporting a reduction in stress on the job and outside of work. An interest in continuing sessions 3 times per week or whenever they desired. An enhanced job performance. They showed more care towards patients. There was an improvement in interpersonal relationships and an increase in creative on-the-job problem solving. So the findings indicate multisensory rooms may be effective as a relaxation therapy for non-clinical populations who experience job stress. So expansion beyond clinical settings was valuable to explore, as it may be able to reduce stress in other areas in addition to the workplace. So I wanted to take these elements and put them into an institutional setting for post-secondary students. A few of the stakeholders that I addressed are just listed here: students, the institutions, designers, staff, faculty, family and friends, society as a whole, visitors to the schools, groups associated with mental health, and potentially equipment suppliers of Snowsland equipment, depending on whether you're creating an environment or a room. So with the lack of control in an educational setting where students can get caught going through the motions, a multisensory interaction can allow them to regain control of their feelings and help to cope with the struggle to deal with the impact of life challenges. Currently, the services provided to students struggling with mental illness can be counseling, hotlines, health promotion events, a medical doctor, meditation classes, the list goes on. These services vary depending on the institution, of course. If the design of universities was reevaluated to provide an immersive sensorial experience, students may feel less stressed, similar to the results from the mental health nurses. So some of the items that I need to take into consideration for this study was the practicality and acceptance. So discrete as to not be the center of focus, but obvious enough for people to enjoy and use. So that's referring to whatever solution I was proposing. We didn't want it to be like the main focus of the school. It still needs to be somewhere where people felt safe to go and not completely obvious. The second consideration was whether to create a universal or personalized experience. So common design practices these days are creating universal spaces, but something that we focus on in inclusive design is a one-size-fits-one concept with the ability to make alterations for different parties. And third, probably on most people's lists right at the top would be cost. So of course, the type of solution that I was proposing is best for new construction and is for sure more realistic. It's a bit more difficult when you need to retrofit an existing space. And then also maintenance was a concern, as often schools are hesitant to invest money into nice spaces in fear of, them getting damaged. So after conducting my survey, site visits, and interviews, the findings suggest there was a strong interest in the subject area, with little to no prior engagement around the role of spaces and places in supporting challenges of mental health at the post-secondary level. So a lot of the responses were that space did affect students and they were aware of how it was affecting them. Some of my key findings were the top 3 ways students cope with mental health challenges at school include having a good support system of family and friends, exercise, and counseling services. 53% of respondents said they began experiencing mental health challenges after beginning or during their post-secondary education. 31% said they were experiencing mental health challenges before, and 16% said it was intensified by attending post-secondary. A common response that I found interesting from my survey was that a lot of students were unaware of the support that was available at their school. which is quite concerning. And there was also a strong need for additional counselors, which is no secret to all of us. There was also an interest shown in access to fresh air and natural light, and an alternative means of support for students that make them feel comfortable. So if they are unable to access counselors or counseling services, we need to have an alternative that they feel comfortable to engage in. So this alternative means of support is what I was proposing and could manifest in a physical space for students that resembles the following: a space dedicated to students for relaxing and unwinding, a space that acts as a supporting service to counseling services, a space that is supportive of mental health by using specific features that stimulate the senses but require little intellectual activity, a space that is easily accessed by students but not the main focus, that is created by students and is holistic and welcoming. These were the key areas. So I created a diagram to reflect my findings and my propositions. It's a representation of the types of areas within the student community space and how they can freely interact with each other. For example, the digital message board in the supportive environment quadrant can also be considered sensory stimulation, and the images within the circles are conceptual and reflect the potential look and feel of the space. So the type of space that I'm suggesting are as follows. First and foremost, it needs to be a space for students by students, which is also a strong element of inclusive design. It is getting people involved in what we want them to be invested in, since they're using the space, of course. The second is to give back the control. Allowing students to have control of their space reduces feelings of helplessness and allows students to manipulate the way their environment can make them feel. It needs to be a community support space. It needs to have flexible and dedicated space. So have different areas dedicated to specific activities, while others are flexible depending on the activity. And then in addition to flexible and dedicated, there needs to be a variety of spaces. Some areas that are closed, some areas that are large versus small, multifunctional, that type of thing. So other key aspects would include a location that is local but discreet, easily accessed by students, not in the furthest, darkest corner of the school. There needs to be good signage. Appropriate and applicable advertising is extremely important, as awareness was another large concern of the students experiencing mental health challenges. A welcoming entrance is important. Stimulation of the senses. Organized, not a cluttered space. Through my site visits, I noticed a lot that many of the mental health spaces available at schools are quite cluttered and can be overwhelming to students who are experiencing anxiety. It needs to be a bright space with natural light or artificial light that mimics natural light. Warm lighting instead of cool lighting creates a cozy and calming effect for people. Views of nature are ideal. Now, when you're doing a retrofit, this could sometimes be difficult, but they can also be artificial views of nature. So you could use a mural or different landscape paintings, bring the outdoors in with plants. Access to fresh air would be ideal. Through my experience, it's difficult to find a classroom or a lounge space that has operable windows. But one of the schools that I did attend, you needed to go get a lever and you could open the windows in that case, and you needed to return it at the end of the day, which made a huge difference to our experience in class. The other important considerations would be things to do in the space. So a couple of things that I'm suggesting are different crafts, books and games, a book buddy program, and this could be run by students where upper years sign up to mentor or provide tips to freshman students, and the freshmen could be provided with contact information and reach out whenever they're in need of a suggestion. Workshops and classes, light therapy. I've proposed a zone out area, which would be a quiet place equipped with sound canceling headphones and beanbag chairs. This is extremely attractive to students. And then an anonymous feedback system is also key, as we need to make sure that we're continuing to provide students with the support that they need. These days, things become outdated very quickly. After creating this list of items, the next step was to think about the relationships between the different spaces. So I created an adjacency matrix, which was used to communicate the type of relationships chosen, which would be direct, convenient, or indirect. And so this was the step before creating a bubble diagram to show the relationship between the spaces. So this is the bubble diagram, and I've used the colors to sort of create zones for the spaces. They're represented by the colors, as I mentioned, and this would be in preparation for completing a block diagram followed by a floor plan. So, a couple things to summarize and bring your focus back to. Schools need to be more aware of the pressures placed on students and more proactive with the services and support provided to students. The support available also needs to be marketed and advertised to students more effectively so that students recognize what is accessible while remaining comfortable and safe. I think that there could be a lot more done with social media, considering how digital we are now. Along with post-secondary institutions, the government needs to recognize and act on the mental health crisis across Canada by prioritizing mental health and therefore allotting the necessary funds. Students need to be given the opportunity to be involved in the improvement of their own mental health challenges by continuing to develop programs and support groups. Moving forward with the for students by students mentality is constructive and embodies an inclusive approach. Lastly, the study revealed the role the physical environment plays in students' lives. One's surroundings have the ability to affect the way they feel and can alter one's experience significantly. Students recognize this and the need for an improved school environment that is supportive of their mental health. And the last thing I actually had on here was another item that we tend to use in inclusive design is to run co-design sessions, which unfortunately in my study I didn't have the time for. It was quite a quick study for me. But in order to make this really an inclusive research study, a co-design session would be necessary to test my propositions, and even a prototype would be ideal. So I actually had a couple of questions for the group as well. I'm always looking to improve my work and to get a better understanding of what people need. So my questions to you guys are, in what way can I make my research more inclusive? And do you have any suggestions for creating a more welcoming, supportive, and holistic environment for students? That would be it. And I guess we're moving into more of a question period as well. I also, you can find me at the link that I provided in the slides and my full paper at the link as well. But Pauline, if you're able to put up the poll questions, I'm not sure.
Here we go. So the poll question I have is, what type of support? Is that the one, right?
Yes.
Okay, so I will launch the first one.
Do I need to stop sharing my screen?
No, you're all good. We'll wait a couple of minutes to see people's response, and then I'll let you know what's the numbers.
Okay, so I don't need to see the poll right now, because I still see my screen.
Okay. So it seems that we'll wait a little bit more for people to answer. All right, so we have about 73 for counseling services, 20% for program and support, and only 4% for environmental indoor, and 2% for others. Would you like me to launch the second one?
Yes. And so I just want to explain the reason I have the second question is I sort of anticipated counseling services would be the most accessed. So I'm really interested in determining what the second most accessed is, sort of what the backup is for students aside from counseling services.
So that new question you have on your screen is for the second most accessed. And so far, programs and support group seems to be by far the most accessed in second.
Okay.
Okay, so it's 16% for counseling services, 61 for program and support group, and I'll give you those numbers anyway at the end. Anything else on your side, Amanda, before I switch over to questions?
No.
Okay. All right, so we are at the end of this webinar, so now you can keep populating your question in the question box, but I will ask one of the first questions we had for Loveless. So the question is, any tips for getting administrative organization buy-in for policy changes that supports well strategies?
Yeah, so I would say a couple of pointers for that one. The first I'd say is maybe just approaching a minute about having a conversation about mental health that's expanding from the typical conversation and looking at it more of like a holistic approach to mental health. And I think too, including in that probably wherever you are at the college, university, there are probably a lot of different programs, incentives, different programs are available for mental health, but this is really looking at different way to approach it to help with it. As well too, I'd say that would be maybe the first part. The other part I'd say is once you have that initial conversation, it could be as well too just providing some research really. So the links I have on the last few slides of my PowerPoint, the well and the gaps, they are great resources that you can grab some stats from there. And that's another way to really show that these things that you're considering to include, doesn't have to be everything, but these things can really help to make an overall well-being, not only for mental health, but just for individuals' well-being. And it's going to impact individuals, staff, faculty, like everyone's benefiting from it. So that could be the other part too, that just letting you know about the research. And the last thing I'd say as well too is just to start small. Like I wouldn't say like when approaching a minute has to be like we need to like redo a whole entire floor at a college university. Maybe it's starting with one room and it's really putting together some different suggestions and using the budget that fits with what Edmund's thinking and seeing how those different small changes can really impact individuals' mental health and well-being.
All right. So just bear with me 1 second before I just get all the other questions. All right. So one of the last question, I think that's for Amanda, maybe. Not sure. One of you can answer. Are there certain wall colors that you can recommend to paint in a lounge to create a great physical space? Not sure who would like to reply to that.
Yeah, I can speak to that. So yeah, of course there's psychology of color, and two of the colors that are most common for people would be greens and blues. And so those would be my first choices of putting in a lounge area for students. I would keep the colors more muted than saturated. people don't want to come into a space where they want to relax and be overwhelmed with bright colors. So color is great to bring in, but keep it more to a muted side.
Awesome. Okay. All right, so that's it for today. Thank you so much, Lovelet, for presenting, as well as Amanda. That was really great and interesting. And thank you so much for joining us and attending this webinar. So we're taking a break for the summer, and we'll have another great lineup of webinars starting September. So if you're signed up to a newsletter, you'll have all the information about those upcoming webinars. And if you're not, sign up to our newsletter on our website. Again, you'll have a short survey that you can fill out as soon as this webinar is over. So please take a few minutes to do that. And yeah, thanks again for attending. I really hope it was interesting for all of you guys, and have a great day. Thank you.
Thanks.